Hello, everybody. Welcome. It's a pleasure to have you here and to join us for community partnerships in the time of COVID-19. We're here to talk about something that's really near and dear to my heart, which is namely the importance of community engagement and action here in a time of crisis, of course, but hopefully as a model for how we work together in the future. Very specifically, we're here to talk about COVID-19 testing and the partnerships that have been developed in the community around COVID-19 testing. I'm honored to have, as part of our panel here today, representatives from several organizations that are critical to testing. So let me tell you those organizations, and then we'll come back later to specific introductions of people. So we have Santa Cruz County Public Health Department. We have Salud Para La Gente. We have Santa Cruz Community Health. We have Santa Cruz Community Foundation, and we have Ucsc in the form of the Molecular Diagnostic Testing Lab. So I'm looking forward to having a discussion with you from these community health leaders as they talk about the collaborative response that we've had to COVID-19 testing. Before we start, I have two just major housekeeping issues to tell you. One, we're having questions at the end of this, and so we're very interested in hearing from you. And so please do send your questions in. We don't have a chat function, but there is a Q&A box that you can put everything in. And then everything is being recorded today, so please know that this will be recorded, it will be sent out, and thank you again for your participation. So we're very lucky today to have Ryan Coonerty here to set this off. And Ryan, I think you all know, is the 3rd District Supervisor. He's been elected to the board supervisor as a board supervisor twice, and starting in 2014. He's been mayor twice. And he's an entrepreneur, an author, a teacher at Ucsc in politics and specifically law. He's also the author of The Rise of the Naked Economy, which was very interesting prior to COVID in terms of thinking about how we rethink work and engagement of people and organizations to stimulate the economy. With COVID-19, it's become even more interesting, and I encourage all of you to take a look. It's certainly affected my thinking. So with that, welcome and thank you very much, Ryan.
Thanks, Isabel. It's a pleasure to be here today. The story of the extraordinary work by the people on this panel and so many people across this community in the response to COVID really begins in February and March, when it became apparent to us that essentially every community was on their own to develop testing and tracing schemes. That even though we were facing a global pandemic, unfortunately our federal government was going to be absent from that response. And it was going to take communities pulling every available resource together to respond. I was incredibly happy that beginning in February and March and up till this day, you've had this really extraordinary collection of researchers and experts at UC Santa Cruz, the Community Foundation, the Santa Cruz Community Health Centers, the county, and all of our providers pull together in a entrepreneurial and adaptive way to try to develop testing and tracing across the county that has led Santa Cruz, although we've had far too many cases like everywhere else in the world and certainly in our country. We've had one of the lower rates in California and then in the country because we've had this community really come together and engage and try to meet this community where it is and get the community the information through testing and tracing that it needed to get. And so I think I look forward to the audience being able to hear about the work that's being done and the work that continues to be done to try to keep this community safe. And by keeping us safe, we're able to keep our economy somewhat functioning, our school system somewhat functioning, our medical system somewhat functioning in a way that we've seen other counties in California not be able to do. So it's a pleasure to be to introduce this panel and to kick off the discussion today.
Thank you so much, Ryan. Really appreciate it. So in terms of our panelists, we have from Santa Cruz County Public Health, we have Cal Gordon. Cal Gordon is the COVID-19 testing task force lead. We have from Santa Cruz Community Health, Leslie Connor, who is the Chief Executive Officer. From Salud Para La Gente, we have Amy McEntee, who's the Chief Medical Director. From the Santa Cruz Community Foundation, we have Susan True, who is the Chief Executive Officer. And from UC Santa Cruz, we have Elena Baskey, who is an assistant professor in MCDB is our acronym, molecular cell and, help me, Elena, development. Thing in biology. She's also the co-founder of the Treehouse Childhood Cancer Initiative and is one of the co-founders of the Molecular Diagnostic Testing Lab. So welcome very much, everybody. We're very grateful for your contribution and presence here. So I wanted to start off by talking about how for Santa Cruz County, the reality of the pandemic became very clear in what was probably the first quarter of the year. And although it was starting to dawn on everybody, you know, in the previous year that this was very serious. In different ways, all of you are very much on the front line, and it's been an honor for us at UC Santa Cruz to be able to work with you on that front line. And so I'd like to start with asking you about how your organizations pivoted to address the pandemic and what kind of transformation in terms of action for your organizations was necessary to navigate this new reality. So for the panel, I'd like to start with Cal, who I'm wondering if you can tell us a little bit about the county response in the early stages of this pandemic and how it transformed actions both for you personally and as a representative of the county.
Great. Thank you, Isabel. First of all, I'm Cal Gordon. I'm a pediatrician and also a Cal College graduate, for the record. Public health's mission is to collaborate with the community to protect, promote, and improve health and well-being. And some of the core functions include addressing epidemics, responding to disasters, mobilizing community action for health. And this was, if anything, probably an unprecedented challenge for all of us. And as Ryan said, we can only best prevail in a pandemic if the whole community works together to rise to the occasion. And one key step early on was the partnership between the County of Santa Cruz and Community Foundation Santa Cruz County in establishing the Save Lives Santa Cruz County, which was designed to facilitate a community-based plan for moving forward to address the COVID pandemic. And the S part of the Save Lives stands for slow the spread. And the strategy is that until a vaccine and human immunity are in place, we must use the tools that we have to spread the COVID-19 and to protect lives. And some of the key strategies are, I think, known to everybody now: physical distancing, expanding public health testing, case investigation, contact tracing, isolation, quarantining, to effectively respond to surges or outbreaks, as well as to expand healthcare capacity and PPE availability. And these key strategies were the focus of public health leaders early on, as well as the communicable disease unit, which is comprised of skilled professional staff who perform epidemiological surveillance, investigation, and follow up with contagious diseases. Another important part was to create a forum of communication to keep people informed, the community informed about COVID management and strategy, the current status, posting where testing is available, and resource information. And so the Save Lives Santa Cruz County website has served that role. And I think that you may have access to that on this forum where you can take a look, but it really helps track what's happening in our county. So I'll stop there.
Thanks so much, Cal. So Susan, as we're talking about this partnership, I'm wondering if you can tell us a little bit about how the Community Foundation has evolved in terms of its efforts on COVID-19, because the Community Foundation has been funding critical community initiatives. It would be interesting sort of to hear how the transformation has allowed you to provide support for COVID-19.
Thanks, Isabel. In some ways, it's a transformation, and in some ways, it's back to our roots. The Community Foundation formed in 1982 as a result of 25 inches of rain flooding our county, causing the loss of lives and much destruction. And the Community Foundation formed as a place for generous community members to take care of our neighbors. And we've always done that. Since that time in 1982, we've become a grant maker for local nonprofits, a convener around pressing issues in the county. And so the night the superintendents announced school closures, I just remember going to bed saying, this is going to be like really, really hard for Santa Cruz families. That was March 12th. We had no idea what was in front of us. But on March 13th, we opened our COVID Relief and Response Fund, and community members immediately started giving, knowing that their neighbors were going to be unemployed, losing shifts, losing wages, having medical needs. We didn't know how disproportionate those impacts would be. There was so much, when I think back 6 months, that we didn't know, that we know now. But we knew that neighbors were going to be required to help neighbors, and that's what the Community Foundation was able to do. In terms of the public health response that Dr. Gordon is talking about, a couple weeks later, after those announcements of school closures, I was at the first food distribution at the Santa Cruz Boardwalk that Second Harvest did. The National Guard was there. And I remember looking at this long line of cars down Beach Street and seeing people that I knew from our community, the clerk at the bagelry, the woman who I've always seen at Bookshop Santa Cruz, I don't know her name. Our local community members were in the line for food and thinking, this is like no other. This can't just be an immediate relief. Let's pay for groceries for people. We have to figure out a sound public health response. And that's when a biologist at UCSC, Dr. Chris Wilmers, connected with me with Dr. Marm Kilpatrick, infectious disease person who consulted on the lab. And I was talking with Mimi Hall and Dr. Gail Newell from the county, and I thought there's got to be a way to get a stronger surveillance approach. As Supervisor Coonerty said, I felt like we'd been kind of fed to the wolves by the federal government, and we were really left to solve our own problems here. And I thought, we can do this. Like we've got the people, we've got the smarts, we've got the heart, we can do this. We just have to bring people together. And, many donors responded in allowing us to help bolster a public health approach, including testing.
Thank you. So let's talk a little bit about that public health approach from the provider side. One of the things that we've been just incredibly fortunate to have as a partnership with medical providers here in Santa Cruz. I'm wondering if we could start with Santa Cruz Community Health. I say that partly because Santa Cruz Community Health was our first community partner at UCSC with our Diagnostic Testing Lab. And so Leslie, could you talk a little bit about the experience for your organization in terms of responding to the pandemic
Sure.
and working with partners?
Sure. So Santa Cruz Community Health, just very quickly, I want to let people know that we were founded by UCSC students in 1974. This was a year after Roe v. Wade. There were no female gynecologists in Santa Cruz at that time, and so we were very of the moment, and that advocacy and focus on values and needs of our patients is in our DNA. We have two health centers, our Downtown Women's Health Center and our Live Oak East Cliff Family Health Center. We serve about 12,000 low-income people, and we have about 145 staff, amazing staff. So I think the pivot was huge, and it was fast. There was almost an overnight immediate closing of our clinics. We shifted to telephonic care right away. We've never done that before. Healthcare is highly regulated, as it should be, but moving very quickly is not something that we typically do. And so, we set up an outside respiratory clinic. We did car-side testing right away. And so it was sort of immediate. I do have to say that we have incredible staff. Staff came together, courageous. I mean, there was so much uncertainty. I think there was some anxiety and fear on the part of healthcare folks on the front lines. How vulnerable am I? How am I going to take care of my kids and my family if I'm perhaps exposed? So there was so much uncertainty, and I think there was a lot of courage and resilience shown by our staff. We set up the incident command system right away, really increased communication. So those were all the internal kind of shifts that we did very, very quickly. And then as Susan and Dr. Gordon noted, there was a lot of movement in the community to set up a network. So, you know, community public health phone calls, you know, regular meetings with other providers, with the hospitals, were ongoing, working with the county on addressing and responding to the needs of homeless patients. We're a Healthcare for the Homeless grantee. We serve about 1,700 people who are considered homeless. And so how does the community going to respond and meet their specific needs? So there was a huge coming together of all these various sectors, and that helped us on the external side to really be prepared. And then I would say that, of course, UCSC was one of those external partners that came in relatively quickly and saved us on the testing side. I think we're going to maybe talk about that later on, but I would just say that Santa Cruz is notorious for healthcare collaboration. We're small enough that, you know, all of healthcare knows each other. So I think it worked. It really worked.
Thank you. And Amy, can you talk a little bit about the same experience for Salud Para La Gente, and also the populations that you serve and how they differ?
So I'm at Salud Para La Gente in Watsonville, and Salud was founded a little over 40 years ago to serve the Pajaro Valley, and we really focus on the farm workers in the Watsonville community. And I echo a lot of what Leslie said with a lot of the similar challenges with changing our systems. And one of the things that was great during that early time when we were all setting up was the collaboration, being able to talk with the other local providers and setting up outdoor clinics and setting up telephonic visits where we don't have best practices. One of the things that we were really concerned about early on when we saw who was at risk for COVID was we were really concerned about our patients, knowing that many of them live in crowded housing, knowing that many of them have diabetes and had a lot of the risk factors. And so with that in mind in our population, we had a big focus on reaching out to people that we knew had more than 5 people in their household to make sure they understood what things they needed to do to protect themselves. Reaching out to our patients with risk factors such as like diabetes and asthma, making sure that they had medications, finding ways to get the medications if they didn't have it. And then also being able to continue to provide services so that we're keeping up with routine healthcare maintenance and keeping up with diabetes care and trying to keep people as healthy as possible during this time so that if they did get the virus, they had a better chance of having a better outcome. And I think some of the early challenges were not really knowing where things were going and getting information, and community collaboration was really important on that, and being able to quickly share information and quickly make changes. And then as we'll talk about later, the testing early on was such a challenge. There was really strict requirements on who you were able to test and who you couldn't test, and it was constantly evolving. And then just not available. And being able to identify people early once we got testing with UC Santa Cruz really did change things quite a bit for us.
Thanks, Amy. Elena, so UCSC started a molecular diagnostic lab early on in this pandemic with testing starting on May 1st. I'm wondering if you can give a little background on the start of the lab and what inspired the lab to come to be.
Sure. Well, very early on in the pandemic, everybody, was talking about testing and how testing was one of the things where we were lagging behind and we really needed to do more testing. And here we were at UC Santa Cruz. So UC Santa Cruz is an academic university. We don't have a medical school, so it has a lot of research labs, but no medical school, no clinical labs. But what we did have at the beginning of the pandemic, and we have at UCSC's tremendous expertise in RNA biology and molecular biology and genetics, which are the disciplines that are very relevant to the diagnostic testing for the virus. What we lacked is really this clinical piece, because there is a big difference. Even though we have technical expertise, there is a big difference between a research lab and a clinical lab. Clinical lab is meant to serve patients and is meant to report results that are used for diagnostic purposes and that are used in patient care. So a clinical lab needs to be able to track samples appropriately, to appropriately handle protected health information, to ensure quality controls that are much more stringent than what is used on the research side. And so we had to figure all of that, all of those things out. I think why we were able to do it is, number one is, huge dedication to this effort from everyone at UCSC, from the leadership down to, every grad student who participated. Our chancellor and others in the leadership have really said, whatever you need, just make this happen. We had grad students, postdocs, staff, faculty, volunteering, working endless hours, and everything was uncertain. It was shelter in place, and we were not supposed to be on campus, so people were worried about their safety. We didn't know much about the virus back then, but people were very dedicated to making that happen. The other piece was there were some regulatory relaxations that were implemented by the state of California that helped us, and in particular relaxing this requirement for each personnel in the clinical lab to have a license. And so that allowed our research personnel, including graduate student staff and faculty and postdocs, to do the testing while they're supervised by a licensed person, but not everybody had to be licensed. And so that was helpful. The FDA also came out with an emergency use authorization process, which simplified the review of the assays. And so now we have this lab, and I think we're very privileged to be able to help our community. It's the pandemic, so everybody wants to do something to help, and many people cannot do anything, but at least for us, we feel very fortunate that we're able to at least do something and help. And so thank you to the clinical partners for allowing us to serve their patients, because it means a lot to us to be able to do something.
Thanks. So let's talk about, so go ahead.
I was just going to add that what Elena mentioned in terms of the speed and sort of the regulations that were lifted really made a lot of this possible. So, we've never been able to bill just for a telephone visit before. And if we weren't able to bill, we can't stay in business. And so that quick ability to bill for telephone visits was really important. The ability for us to sign a contract, it was probably the quickest university contract process known to mankind, womankind. So, that was refreshing. And, if any of this could stay alive, if that in part could stay alive in the future, I would love to see that.
Thanks. I saw us all laughing on the quick contract side, and just to say, it is remarkable how quickly all the systems responded to this pandemic and making things happen. And I wanted to follow up on Elena's comment about reporting and getting information out to the providers quickly, and just ask specifically about the impact that you're seeing on patients in the community. Can you talk a little bit about, and this is really specifically for Amy and Leslie, about patient needs and how this has affected considerations around testing and care?
So for us, we have a different patient population than in South County. About 30% of our patients are Latinx. We have a significant homeless population, as I mentioned, and behavioral health issues are really predominant. Among our top 3 diagnoses are mental health disorders, depression, anxiety. And so, really for our patients, whether they're kids, adults, families, their health risks were triggered by COVID, and those factors created ripple effects of hardship that impacted their health even further. So to start with, all of our patients, take a family of 4, all of our patients are earning $50,000 or less, and more than half of our patients are for a family of 4, are at $26,000 or less. So all of us experience stress and anxiety, I think, during COVID. But when you look at a family facing that kind of economic challenge, it's enormous. So people lost jobs and income. We had always had a food distribution set up at our East Cliff Live Oak Health Center. We were doing, this is a great partnership with Second Harvest Food Bank, and we were distributing every other week. And we switched in 2020 with the advent of COVID. And in 2020 so far, we've distributed over 114,000 pounds of food, whereas in 2019, for the whole year, we distributed about 40,000 pounds of food. So there's 250 households coming through our parking lot every Wednesday afternoon, picking up food, groceries. We've added diapers and baby wipes, baby supplies as well. We worked with the Community Foundation. Susan's probably going to talk about the investment that the donors made in terms of gift cards for people that didn't qualify for public support, public programs, unemployment. So we worked with the Community Foundation and the Live Oak Cradles of Career to distribute about 1,000 gift cards. Behavioral health needs of our patient went through the roof. The increased stress and isolation, obviously, the fires didn't help with that. Increased fear and paranoia from the news cycle. Again, our patients have a lot of behavioral health challenges. Increased substance use, increased relapses for people who are in recovery, increased intimate partner violence, increased child abuse reporting, where there were barriers to getting people into specialty or inpatient treatment because tests were required. So in the very beginning, people were not able to get into inpatient recovery services, for example. And thankfully, when we had the testing set up, we were able to take care of that ourselves. The County Human Services Department, for our homeless patients, they've housed over 500 homeless people in 6 hotels, trailers, organized encampments throughout the county, so that when our patients who are sick and have nowhere to safely quarantine or recover, they were able to get access to a hotel room where there was 3 meals a day served and there was mental health counseling there. So I would just say that overall, you take the ordinary human beings' experience in COVID and you multiply it exponentially, because our patients they're facing not only the medical challenges that all of us have, healthcare issues, but all of that is compounded by these social factors, and it's something that our team works to address every day, and it was just intensified during COVID.
Yeah, and similar for Salud, we serve primarily farm workers, or I think maybe 50% or more of our patients are farm workers who work in ag. And when COVID started in March, a lot of our patients go back to working in the fields in April or May. So they're really ready to get back to work. They might not have been working up until that time. And COVID required people to shelter in place, and they weren't going back to work as soon. Or if they had symptoms or they had to quarantine, it would be missing wages for 10 to 14 days or potentially more. So a lot of our efforts have been focused on increasing our food distribution. We also do a food distribution program once a week, and the demand for that has increased greatly. And then also wage replacement, which we've given out $1.5 million through coordination with Community Ventures and UndocuFund for people who need to isolate or quarantine. The risk with what we're worried about is that people are required to isolate or quarantine to stop the spread of this. But if they also need money to pay rent and to feed their families, they're going to continue to work. And so that's really important, having that financial support so that people can successfully isolate and quarantine. And that's been a big focus. We've also had a huge increase in our needs for behavioral health. One of the things that's been great with the telephonic visits is it's much easier for people to access those services. So we've also seen an increased demand for therapy as well as psychiatric services during this time. And thankfully, we're able to provide more access because we're able to do the telephone visits. We are able to have some therapists that are living in other parts of the state that are able to work for us because they can do the visits over the phone or over video. So that's been a huge help. And I think that those are the main needs that we've been seeing is financial and food and just an increase in behavioral health and other types of visits. And we also have a dental clinic, and it took a while to be able to open up dental. And so right now what we're seeing is catch up on people who've missed care and haven't been able to get routine care, and now playing some catch up in some areas as well.
Thank you. Susan, it sounds like the Community Foundation has been able to enter into that space of where there's gaps in provision of care. I wonder if you could talk about that a little bit for the audience.
Yeah, we had a couple of principles when we first got started, not knowing what was ahead of us. And one was that we would act swiftly, that we knew that a lot of the systems responsible for caring for people necessarily move slower than we're able to move. We're a small organization, but we're mighty. So acting swiftly was one principle, but another was to fill the gaps. You know, we knew that there would be people left far behind by the federal stimulus. As Leslie and Amy have spoken to, there's big concern about undocumented immigrants and families who with mixed immigration status, and we wanted to make sure that those community members were cared for, as well as, you know, cash economy workers, frail seniors. We just thought, you know, where are these gaps and how can we use local philanthropy to fill it? And, you know, when I say the Community Foundation responded, it's really that this community responded. You know, when people received their CARES checks, they gave them to the COVID Relief Fund. You know, when this community has just continued to step forward. So I just want to acknowledge that it's the Community Foundation is all of us, and people have given in so many ways, you know, $5 contributions, all the contributions that equaled the amount of their CARES check. I think people felt really strongly, like, I didn't lose my wages, but I know people in this community are really hurting. That's another example. You know, mandatory IRA distributions, people gave to our fund. I think it's really important to acknowledge that this community continues to come together to fill those gaps. And that's what we've been able to do. You know, some of the big gaps that we continue to see, the Community Foundation has been providing about $500,000 a month in direct financial assistance. So we're still seeing families on the edge of not being able to pay their rent. And even with the eviction moratorium, we don't want people to get so far behind. So one of the things that we've talked about with all of our human services partners is like not one more homeless family because of COVID, because of reduced hours, by people who want to work and really can't get help otherwise. So we have relied on this network of really strong nonprofits in the community who know and are trusted by people who have often never asked for help before, who now need help more than ever because of the economic impact. So that's been, you know, a big part of our work, and at the same time trying to build this, you know, public health infrastructure and make sure that we have the testing and the contact tracing available so that we can get through this with as minimal health impact as possible. So we're looking at both the health and the economic side of this disaster.
Thanks. One of the things that's become really clear is that COVID is exposing race and income disparities. And you talked a little bit about that. All of you actually have already talked about that a little bit. I'm wondering from the health equity side, Cal, can you talk about some of the data that the county has gathered on this front? And
yes, I'd like to, and thank you for bringing that up. So the Save Lives Santa Cruz County website actually has a dashboard, and it looks at the positive COVID cases through an equity lens. So it actually has a tab that says Equity View, and it confirms for the South County, our Latinx population constitutes 33% of our population, but to date, 62% of our county's positive cases are Latinx, And we haven't seen this disparity for other ethnicities, but in this population, yes. And similarly for the South County, which constitutes 28% of the county's population, we've had 62% of our cases are in the South County. And I want to thank the UCSC Molecular Diagnostic Lab, as well as the Community Foundation, for really sort of looking and seeing how we can support that. And public health has also really tried to see how we can improve testing and our capacity to respond. So we actually put the state-funded testing site OptumServe at Ramsey Park Community Center in Watsonville for all of the community, but also to increase access. We are partnering with Salud Para La Gente to make sure that they have adequate testing capability, and thanks to with UC Santa Cruz, they have a great turnaround time. Before, they had limited supplies. I believe both the Community Health as well as Salud, it was long turnaround times. They were limited in terms of supplies, and with UCSC and their platform, they can test as needed, and there's not this limitation, and we get tremendous 24-hour turnaround. But the public health has also worked with Salud Para La Gente to actually be part of the contact tracing, case management, and outreach, which is wonderful because we have a culturally literate group of individuals who can have the trust of the community to really serve public health in that arena. And we do have housing for people who need to be isolated in that area, as well as some mini grants to assist with public communication to address safety measures. So I believe that there is a focus among all of us in terms of how we can go to where the action is and make a difference.
Thank you. Is there anything else the panelists would like to add on the health equity side? I know that from the lab perspective, we see differences from different organizations, and it's remarkable.
I think one comment is in community health, for a long time we've talked about social determinants of health, and that's been a focus where we're focused on where a person lives and where they work and how that impacts their health. And that's really what COVID has demonstrated for everybody, just showing that when we're seeing this in South County and we're seeing it in the Latinx community, this is where a lot of our community's essential workers live. And they're continuing to work, they're low wages, they have crowded housing, and we're seeing the impacts of that on their health through COVID. And so I think, unfortunately, it's brought to light a lot of issues that have been talked about in community health for a long time. And now we're seeing it demonstrated in a really pretty awful way.
Yeah, I would echo Dr. McEntee's comments, and I would also want to give Salud and the Santa Cruz County Health Department's clinic in Watsonville, a big kudos, because the positivity rates that they've been seeing at 20 to 30% are really off the charts wherever you look in the country and locally. Our rates in North County has been the highest so far, and we are expecting more surges, but the highest so far has been 12%. So there is a definite distinction along race and ethnicity in terms of people who are getting sick, people who are hospitalized, and people who are dying. So, that can't be overstated. I think the other common denominator for us in the North County is poverty. And I guess I personally have just this reaction when I hear on the news people talking about how COVID is peeling back the curtain to expose a disparity. And, community health centers have been fighting for decades on the front lines of those disparities. We've seen it We've been advocating, we are working to solve problems. All of society's biggest problems end up in community health centers, and they're laid at the feet of the provider. So, you know, the opioid epidemic, homelessness, childhood trauma, lack of education, lack of support for immigrant communities, all of that we see decade after decade after decade. Homelessness, the average age of death for a person who is homeless is 50. Childhood trauma occurs not because people are evil or bad, but a whole confluence of factors that end up creating a lifetime of mental and physical risks. Working with Live Oak Cradle to Career parents, they want for their kids what all parents want, right? A good education, good health, and for their kids to be good citizens and have good characters. And this is what they tell us. And yet, how can they do that? How can they support their kids when their school doesn't have enough laptops to go around for remote learning? 26% of Live Oak Elementary School students are considered homeless. So I guess I just want to say that we're going to be out there on the front lines doing that work always, and that we always have, and that this isn't new. And that's why our mission includes the intent to advocate the feminist goals of social, political, and economic equality, because you can't have health without those rights. It's called public health for a reason. It's public, it's for everybody. We believe healthcare is a human right. And so, you know, we and Salud and the county and the community health centers and, you know, all of us on this call are really trying to create a lifeline for community members. And, you know, what with the current state of affairs, it feels like we're going backwards, but, you know, we're never going to stop.
Thanks. There's been a lot of discussion about partnerships in this panel. One of the things that appears remarkable about COVID-19 is the degree to which the services that all of you are providing appear to be closely intertwined. Certainly we see that on the UCSC side with respect to reporting and talking directly with providers. We see it in terms of task forces that are developed between members of this group. I'm wondering if you can speak to, you know, the growing intersection of what it means to provide personal care, policy, science in this community, and how you imagine that both changes the ability to respond to COVID-19 and perhaps how we respond to other community issues in the future. Susan, would you like to start?
A big set of questions.
I know, do them all at once.
I mean, I think what holds true is sort of my opening statement, that this community knows that while we'll, you know, accept help from the state and the federal government, and we expect to get our fair share, that we know that we first and foremost need to rely on each other. And I think that has only been strengthened through this. You know, we laughed earlier about the UCSC contracting process, but it's actually kind of a moment of healing where we can go in and trust each other and say, we're going to get this done together. We don't know exactly how you're going to build a community foundation for tests that, you know, Dr. McEntee is going to do, but we're going to figure it out. And we're going to figure it out because we're what we have. And I think that level of, you know, building on trusted relationships, increasing trust is the thing that I hope most lasts through both the fires and COVID, that, you know, we can turn to each other and we continue to do so. I think that's really the fundamental important thing in all of these partnerships. You know, Leslie and I have worked together like for a century, you know. You know, our work started, you know, trying to make sure that every uninsured kid had, regardless of documentation status, had preventative care and insurance coverage. And that was a long time ago. But, you know, before COVID hit, we were working together on a project that's super dear to my heart, which is her expanded clinic on Capitola Road with Dientes and Midpen Housing, the Health and Home Project. There's tons of good work ahead of us, as well as right at our doorstep right now. And I just think that those projects are going to continue to require us all coming together. So that's my little community cheerleading pitch, but I really, really believe it. And it's the one thing that I think we can all know to be true for this. We have, as Dr. Gordon said, we have had lower rates than many parts of this country. You know, it'll be uneven. We'll have some spikes here and there, but we've had a couple of good months, and I really believe that's because of these efforts are really coming together now.
I'd like to add on a couple examples. You know, Leslie mentioned that the medical community is small, knows everyone, but public health has been having weekly meetings with like the hospital leadership, as well as our medical directors and administrators for our skilled nursing facilities. And that ability to come together and work actively on how we do our testing, how we do our management, making sure that everybody's sort of on track and that we work together has really been major in terms of allowing the capacity to respond to the challenges we have. We have challenges in terms of our you know, positive cases in a number of these settings. And similarly, it was just great fun to see academics coming out and learning the medical community world, because you know they are accustomed to doing things sort of in their purview there, and this is much different. I mean, how do you report to the state? How do you get this documented in our health information exchange that we have, that all the providers use? And these are a lot of operational issues that were completely de novo for our academics, and they're up to the test in terms of response. So the number of barriers have been broken down. Public health is working in a much sort of direct fashion with our community safety clinics or federally qualified health centers. So I can't see this going away. I see this continuing to build on these relationships.
Elena,
Me again.
go again. Go ahead, Leslie, and then I want to ask Elena a little bit.
So I would just underscore again what everybody has said, and you know, the UCSC lab, the quick setup really gave us capacity where there was none, as Dr. Gordon said. And you know, the idea that local action makes a difference, we weren't relying on some sort of outside corporate structure. All of that made taking action easier.
Thanks. My question to Elena follows up on that community action bit. So we were talking about reporting, and we were talking about, you know, Cal was mentioning sort of the complexities of what that means. Elena serves as the clinical laboratory scientist for the Molecular Diagnostic Lab, which essentially means she's the only person that we have right now who is able to report on cases. And of course, that requires a very quick turnaround because we're in the middle of a pandemic. Elena, I was wondering if you could talk a little bit about sort of that intertwining of all of these community roles, specifically as it relates to your reporting requirements and the dialogues that you've had with providers and others as part of that.
Yes, so from the very beginning, we focused on fast turnaround because that was what this community needed. And so we designed a process where for positive results, we can provide a verbal result to the provider in the form of a phone call or an email, you know, as humanly fast as possible, which is typically on the same day. So the samples come into our lab around noon, and then that night around 8 or 9 p.m., we could provide that positive report to the provider. And then that is followed by the actual like hard copy of the report through this SHIO resource that Dr. Gordon described. So we really focused on that and did our best to deliver fast turnaround, at least on the positive. On all of our cases, the average turnaround is about 26 hours. From the time the sample is received in the lab. In terms of partnerships, I also wanted to mention that we're very grateful. All our partners have been very, very patient to work with us as we are developing. You know, we want to increase our testing capacity, and so we have a number of different changes to the process that we were trying to implement to increase that capacity. And so it's really a back and forth process with our partners. They provide feedback, then we take it and improve. And I just want to recognize that it's, they've been really great to work with implementing those changes. And we asked them to do a lot of things and they always were willing.
I think Amy and I are both laughing because we know that we've asked Salud Para La Gente to help us with much of that. I'm wondering if you would like to talk about some of that work, Amy.
Sure. We don't really feel like it's been a big ask, to be quite honest. And I think one of the things that's been really great about this partnership is that when we order through other labs, we're not talking with the people who run the labs. We just get like a report back. But we get a report like every night from Elena. And I don't know, there's some security knowing that like she also cares about our patients and she cares about us doing this well and is really part of the process. So that's kind of been really, I think, unique about all of the partnerships is that we know that everybody has the interest of the community and the interest of the patient. And it's not this big business thing, and that's been really great. And it's been great also working with UC Santa Cruz, being able to give feedback on what's working, what's not working, and being able to scale up as we go, even as we're making changes. And we don't get that many opportunities where you can make quick changes and continue to move forward. And that's been great. I think when we started out with doing like 10 tests a day, and now we're at about 60 per day, and continuing to go up. And we've been able to do that while also making adjustments in our process and you guys making adjustments in your process and moving together. And it's been really great.
Thanks. So before we go on to the Q&A from the audience, and I want to remind people, please feel free to forward any questions that you have and we'll go through those soon. We hear an awful lot about the negative things that are happening right now during this pandemic. And one of the reasons that we wanted to have this forum was really talk about how the community has come together in this extraordinary partnership, because it really is awe-inspiring. I'd like to just take a moment to look at the opportunities that this pandemic and this time has brought forward and what things have built up and what we can use in the future. We've talked a little bit about some of that. I'd love to hear from the panel about what they're seeing in terms of ongoing opportunities.
Isabel, I think it's important that we talk about the economics of the situation too. And the business community, and by the business community, I mean our bricks and mortar small businesses that we all know and love, are really at risk right now. And so our ability to keep those businesses and our very local economy going depends on all of our behavior. And so I just want to put out a plea that while we've had, declining case rates in August and the early part of September, we're seeing some uptick right now. It's really important that we don't get misguided and forget that if we all aren't responsible, we're going to shut down those businesses. We're going to lose more jobs. We're not going to have a bookshop Santa Cruz to come back to. We're not going to get to go to our favorite restaurants. And I don't mean to be on a soapbox, but this is a binding part of our community, and it's countywide. And so, keep that physical distance. It really, really, really matters. Stay outside if you're with people who you don't live with. Make contacts in stores brief. This isn't the time to be chatting, with a server in an outdoor restaurant. We really need to take those public health messages to heart, because what we're seeing across the world is that subtle changes in behavior to revert back to our old normal cause huge damage. And we don't want to see our businesses and our workers lose their livelihoods. And we don't want to not have these businesses to go back to. So I just want to put a little plug for that part of this, because it truly is the foundation of how we all live our lives here.
And Isabel, I want to just add briefly to that. I think Susan makes a really important point, that now is the time to invest in the community you want going forward. And to the extent that nonprofit organizations or small businesses matter to your quality of life, now is the time to make sure you're making that to ensure that they'll still be here. But I also want to say, you know, I've now been in this long enough to remember that when I first got into elective life 14 years ago, there were 14 lawsuits between the city and the county and the university. And we're essentially only talking to each other through lawyers. Now we're at a place where these partnerships in this and so many other areas are occurring. We're now looking at watershed restoration. Certainly the university was integrally involved in the fire efforts. And, you know, we're, as we faced crisis on top of crisis on top of crisis, I've been spending a lot more time thinking about resilience. And one of the ways that we are resilient not only is through the physical design of our environment, but by essentially social trust and cooperation. And there's a lot of dynamics in the world today that are ripping us apart. And to the extent that we can use these events to remind us of our commonalities and our cooperation, to find new ways of doing things, contracting or partnerships or leveraging the intelligence or resources at different institutions, I think I'm hopeful that going forward, we're going to continue to build on that so that we can be more resilient for whatever the next crisis or crises are that we face going forward.
I just wanted to say on the lab side, as I mentioned, you know, this is the first foray into diagnostic testing for UC Santa Cruz, and we're not used to this. So it's truly been a privilege to be able to serve community members and patients directly, you know, have a direct impact. So we're very grateful for this opportunity. And, you know, we're hoping we won't have to, but if there is another pandemic, we now have a molecular diagnostic lab at UCSC. And, you know, outside of the pandemic, we hope to continue diagnostic testing, and we're now positioned to really translate our research advances that we have on campus into clinical care. So this is going to be hopefully continue to be useful to the community.
Yeah, I would echo those words too, and say that we are really appreciative of this bridge that has been built between the Community Health Center and UCSC. We haven't really had a chance to partner, other than having our founders be UCSC students from long ago. We haven't had a chance to partner with UCSC, and they're, you know, we're a living laboratory for, as I say, these social impacts that are happening for political reasons, for sociological reasons, economic reasons. And so this idea that we could continue partnering with UCSC, whether it's in a research capacity or whether it's faculty or other members from the university community who want to serve on our boards, people need to, you know, consider donating to either any of the organizations that you've heard from, whether it's at the Community Foundation or for us or for Salud, because your financial investment makes a difference and allows us to do the work we do. So I'm hoping that there's a lot more to come now that we have sort of this bridge that we built. The other thing I just want to mention is that I think that the chaos and uncertainty we saw at a national level in Washington and the CDC, even the WHO, certainly filtered down to the local level across the country, all this mixed messages and misinformation. And I really want to give big kudos to our public health department, Dr. Gordon and Dr. Newell and Mimi Hall and Dr. Ghilarducci, who really wanted to step up. They focused on the science and evidence as it was unfolding. They worked closely with the state, and they were very cautious and really thinking about the public health interest. And so I just have a lot of respect for the fact that, you know, chaos aside from above, locally, we were on the ground, our sleeves were rolled up, and you know, UCSC's lab played a huge role in that too. So I'm grateful to be a Santa Cruzan.
I think one thing that I'll add is I hope to see continued partnership, because I think it does, it made our work easier and better. And I think it's a lot of why the county's doing well, partnership across all organizations. One of the other things that we've had that have come out just in healthcare with the pandemic is this being able to do telephonic visits and being able to do other things that we weren't typically doing before that would be great to see continued on. Because what we've seen with these telephone visits is they've been great for people who don't have to take the day off of work to come. They do their doctor's visit during their work break. They've been able to, it's just created a lot more access for patients. And then it's, the whole situation has also created other things. Like early on when we realized, oh, our patients with diabetes, we really need them to be able to control their diabetes. And a big barrier is access to medication and being able to afford their medication. And we're like, wouldn't it be great if there's some way that we could contact our patients with diabetes and get them the medications that they need? And then it turns out we were able to do that. And so it's really opened up our way of thinking to things. And then with some of the different policies that were put in place at the state in terms of billing and stuff, it's allowed us the opportunity to do things differently that would be great to do when you're not in a pandemic as well. And it'd be good to be able to continue a lot of that on.
Thank you. I'd like to move on to the questions, which I think go to many of the issues you've discussed, but there are some specifics that people are asking around testing in particular. And so I'm wondering, can you share a little bit more about the testing availability and process? So I think this question really goes to access to tests in Santa Cruz, and everybody on this panel actually has a little bit of information on this. Perhaps, Cal, you could start with talking about the county picture in terms of testing.
So,
yeah, go ahead.
Fine. So early on, I got recruited for Save Lives Santa Cruz County, and then subsequently segued to the Public Health Department. The very first thing was to really understand where is all the testing being done. Let's get it out to the public, that type of thing. How do we strategize to use testing most effectively? And the reality is that even now, the testing demand outstrips our supply. So it's really important that, that UCSC has continued to increase its capacity for testing. That's really allowed those people who maybe would not have had access to testing to have that capability. And really, again, I think has made our community safer because of that. OptumServe does 150 tests per day, 145. In total, we do roughly about 450 tests per day. Is that enough? No, it is not enough. We've had far demand. We had a real challenge about opening our schools, where we're going to be able to do surveillance on our teachers. The good news is that the county school superintendent has been working with Stanford, and it looks like that there may be a program that will be available to be able to support the opening of schools when that's appropriate, without taxing our current provision of testing. So it really is still a challenge. Materials supply chain to even a lot of the labs is really restricted. UCSC chose to use a different source of materials, which is great because they have been able to be a really consistent supply on that. So I'll stop there, but testing is still an issue in our community.
I'm conscious that Elena needs to leave because she's working on pediatric genomics review of patients. And so before she does, we do have a question that's very directly towards the molecular diagnostic testing lab. And so I'd like to go to that one first. So the question is, I've heard that the diagnostic testing lab on campus is expanding. Can you tell us about that expansion and what that can do for the community?
Right, so right now we're conducting about, I'd say, 150 tests per day for the community. This fall, we're also starting surveillance testing for students on campus. And so we're students and faculty. And so we're looking at potentially going to thousands of tests this fall. So that's going to be a huge expansion for us. But we will continue, of course, serving the community as well while we do that.
So it's an anticipated expansion on the community level and on the campus level. And so on the testing side, for both Leslie and Amy, what are you seeing in terms of testing needs going forward?
We're currently testing in the California Department of Public Health Tier 1 and Tier 2. So people who are symptomatic or had an exposure or essential workers. And our demand, we've continued to expand our access, and it took a little bit of time, not that much time, but a little bit of time because we had to hire more staff to do more testing for collection. So right now, I think we're usually averaging around 50 tests per day, and we're hoping that should continue to increase. We've been available to a couple of a company down here that's doing their testing with us for their employees who are essential workers, or if they show up and they have symptoms. And also with all of the close contacts from anybody who's been positive, we're starting to do surveillance testing on our own staff who work who work in the hospital and who work with testing patients, or if they think they may have been exposed at work. So we're continuing to see a demand. I think one challenge has been, I think it's hard for people to, there's a lot of different information, and there's been a lot of good information put out locally by our public health and all. And still people understanding that it is important to get tested, that when they do have mild symptoms that they should come in and get tested, because then that gives us the opportunity to isolate and do the contact tracing. And so we're seeing that some people are calling in just for I think I have a cold, and we're like, well, no, that really does need to be tested. And we are seeing people who think they just have a cold and it's coming back positive for COVID.
For us, we're testing about 100 people a week. So again, the case rates up in North County are much different than in South County. We've also been doing testing for our staff. We were doing monthly. We've now increased it to every 2 weeks. And we've also been doing some testing for other agencies like Encompass and Dientis, amazing organizations that serve patients, but obviously don't do medical services directly. So they've been sending their staff and some of their patients to us when needed.
To the question on testing, there's a specific question which has been mostly addressed by the panel, but I wanted to go into a little bit of the details, which is specifically the availability of testing from an equity lens. And I'm wondering if you can explain to the audience how people come to get testing, what the options are in the community, and what happens for different groups of people in terms of their experience.
Well, maybe I'll start. People can go to, again, Save Lives Santa Cruz County. It does list pretty much everyone that is providing testing. If you have health insurance, you can go through your physician. I think whether you have Pam Sutter or Dignity or Kaiser Permanente, typically they want you to call in, talk to the doctor, and if you meet this kind of level of tier 1, tier 2, as Amy was saying, you've been exposed, or you're an essential worker, you have symptoms. You will be tested, and even for surveillance testing, that the agreement is there. For the public, you can register with OptumServe. You can just Google them or look at the website again. That you have to register online, but it's free, and it's 5 days a week, Wednesday through Sunday. There's a number of other sites. We have our federally qualified health centers, including Planned Parenthood. There's a whole series, and geographically they're available. It can be a challenge to get in and be seen. There may be some things changing in the future. Our skilled nursing facilities recently got point of care testing, where you can, it's like being tested for strep or flu in the doctor's office. This may be available in the not too distant future in the next few months, where I think there will be sort of a broader array of testing capabilities. But right now, we are challenged, and I would say go to the website, and there are a lot of choices that are available.
And I just wanted to say from the lab side, we accept samples to be tested that are submitted by medical providers. So we don't collect, the lab does not collect samples ourselves. So everything we test, it comes to us from medical providers that are here on the call. And for our UCSC students, they come from our UCSC Student Health Center, student and staff and faculty.
We are basically testing our patients, right? So the patients that have symptoms or have been exposed, those are the folks that we are testing. As I said, we have expanded it out to test patients and staff of colleague agencies. And so we've also accepted new patients as a result, of people who are worried about having symptoms or who have been exposed but don't have a primary care provider. We've taken those patients on as new patients, so they'll show up, they'll sign up as our patient, and then they get tested. So we're also doing that.
Yeah, one thing that we've noticed is, you know, that 18 to 34-year-old age group is where we've seen a lot of the spread. It's a lot of that age group has a lot of essential workers as well. And it's not necessarily an age group that has a primary care provider or goes to the doctor often. So we've been accepting quite a few new patients to get in to be tested. So people who don't have primary care providers, we're able to accommodate them. We test 7 days a week. Monday through Friday, we have curbside testing, which increases our numbers a lot during those days. On Saturday and Sunday, it's really more for just our patients who are coming in who are ill and need to be evaluated by a provider. And we run those on Saturday and Sunday as well.
And if I could add on, for the county clinics, the experience is very similar to the Community Health Center in Salud, where everyone can come. If they don't have providers, they can be tested at our clinics at Emmeline or in Watsonville. And also they can become patients at those clinics too if they don't have a physician or provider.
And just to clarify, we are not doing testing downtown at the Women's Health Center. The environment there is just not set up. So we have our testing site is at our East Cliff Family Health Center in Live Oak.
We had a question come in. I think both Elena and Cal referred to campus testing, and we've also had a reference to surveillance testing. The question is defining surveillance testing.
For a number of groups of people, maybe I'll use a skilled nursing facility as a choice. Originally, the skilled nursing facilities in May were mandated to do surveillance testing, where they would test all of their residents as a baseline, and then would do surveillance on their staff on a monthly basis. And now this has been changed to even weekly, so that so this is, you may not be symptomatic, but because you work in an essential area, you may be a healthcare worker or working in a skilled nursing facility, where it is important that you are tested as sort of a sampling to make sure to really identify if there are any outbreaks. And it's a way of sort of tracking people to that. And so when we say there's a prioritization for essential workers, people who work in agriculture, who work in the food industry, people who are publicly facing are also viewed as essential workers, and there will be potentially different recommendations based on what you do, but some of these are more regulated than others. And so this is where people aren't symptomatic, but we're still sampling those group of people on a regular basis.
And for the UCSC campus, we want to do this testing to prevent an outbreak. People have heard on the news there are outbreaks at many universities across the country, and so we want to prevent that here. And most of the learning now happens online, but we do have some essential in-person activities that take place, and we do have students who live on campus and students who have to be on campus for their studies. And so we want to test those students regardless of whether they're symptomatic or not, to help prevent an outbreak. Hopefully we don't get it here.
Thank you. That addresses, we had some questions about UCSC testing directly, and that addresses most of those questions. We do have online classes in the fall, and so the testing that we're looking at for campus really is to protect the people who have to be on campus, either because they lack housing or because they are essential in some way on campus, but it's a reduced population for sure. We have a question directly for Leslie. You mentioned that you've been able to enact swift changes to combat COVID-19 in a field where change usually happens slowly. Has the pandemic forced you to make adjustments that you hope are lasting? Do you expect your approach to healthcare to look different in the coming years? Some of this you've talked about with respect to telehealth. I'm wondering if there are additional changes.
Well, I mean, again, and as Amy mentioned too, yes, we are hoping that there's going to be a lot of public advocacy around telehealth to make sure telemedicine, that could be virtual healthcare, and that is a mode that we are all developing. Some are ahead of others, and that is billable, but it takes a little bit more technology both on the provider side and on the patient side. So specifically the telephonic care that Amy was talking about, which is so convenient, especially when we have vulnerable patients that, just getting somewhere across town is difficult. That makes a huge difference. And in behavioral health in particular, we've seen lower rates of no-shows and last-minute cancels because people can conveniently access their mental health provider. So those are some obvious ones. I think that we've learned a lot in the incident command system that we've set up, both in terms of internally in our organization and around the community. So this idea of the way that we are working in an emergency, there's a lot of benefit to that in terms of how we're going to work in our, once all of this one day goes away like magic. That is I think we've learned a lot about how we relate to each other, structures, communication, being able to tolerate change quickly, not being sure if a change is going to work and going for it anyway. So those are kinds of things that, those are sort of approaches to work that are difficult in healthcare. Usually we do a lot of testing and before we, process improvement type testing before we implement anything. And so this has been a different mode. So I think that is important. When we're looking at our new building that we're building on Capitola Road, it's a new 20,000 square foot health center with dentists serving our patients in their own new 11-chair clinic, and Mid-Penn has 57 units of affordable housing. We're looking at our physical space and the design and what does that look like in an era of COVID, in emergency response, in infectious disease control. So there's things that we're working into our facility design that we've learned will be beneficial going forward.
We have a question about following on this idea of community engagement. If you're not a medical professional, right, and you don't work in the community, in the county, or in a specific role that has to do with testing, what is it that you can do to engage in trying to help this pandemic? Can you speak to what there is available to help for people who are not medical professionals or not engaged in testing?
I'm happy to speak to some of the basics that I think we've seen be really powerful in the community the last 6 months. You don't have to be a leader of an organization to be in a community partnership. And, you've got some leaders here and we're all really proud, I think, to be here together. But some of the most powerful actions that I've seen in the last 6 months have been, the woman who constantly checks on her frail senior neighbor and make sure that, she's there, she's isolated, she can't go out. She is very likely to die if she gets COVID, and So this one neighbor checks on this one neighbor and makes sure she's okay. People are starting to fray at the edges of this feeling of isolation right now. So check on the people that you care about who might be alone and afraid right now. I think that's like a really key and important thing. I said it before, but shop locally. And, you know, I hope I don't get sued for this, but Jeff Bezos does not need more of our money, you guys. And we've all fallen to buying things online because we were afraid. We didn't know at first if surfaces could infect us. We didn't know. And we got into habits of online shopping, but our local merchants really need us to come back, and it's safe to do so. Follow those guidelines. It's safe to do so. I think that's another really important one. The needs continue. You know, as we said, these are disproportionate impacts, and people who are already living on the edge are having a hard time. So I think, you know, give to, as Leslie said, give to our COVID fund or our fire fund, give to one of these organizations. There's big work ahead of us. We're not through this. You know, another thing, we know that somewhere around 70% of people who have been infected locally were with somebody who was already presenting symptoms. So the public health part of this is essential, that we all take seriously. If you have a fever, cough, if you're sniffly, if you're achy and have a headache, any of those symptoms, you need to stay home, you need to get tested. It's our responsibility to try to keep as much open and our rates down as much as possible. So, you know, those are a couple of things that I think are really important. And the last one is kind of hokey, but say thank you. You know, that clerk at Safeway or wherever you shop, you know, needs a thank you. They've been at this a long time with a lot of exposure. And I just think kindness to each other in this ever increasingly kind of mean world we're living in is super important. So those are a few at the top of my list.
I'll go on to one very specific question that we have around the testing of wastewater. So it says testing of wastewater has shown promise as a fast, resource-efficient strategy for community surveillance. Are there active programs for wastewater testing or other environmental surveillance within the county? That's directed towards you, Cal.
So the answer is yes, and I wish that Dave Giladucci was here because this is one of his favorite themes. We talk about wastewater all the time. But so wastewater is being tested, and it seems to precede an outbreak by 2 or 3 weeks. And so our epidemiologists are looking at it, and we are trying to correlate and actively look for cases where the wastewater may be suggesting that there's an outbreak. And so this is sort of it's just as you think, we look for the amount of virus in the wastewater, and if there seems to be a peak, you're really focusing on that particular area and trying to see where the source may be.
Thank you. I have a question about the ability of the lab to do tests other than COVID-19. I'm going to take that question because I know Elena has had to leave. So the lab itself tests for COVID-19. We're authorized only to test for COVID-19. We're part of an emergency order that Elena mentioned that the state has made possible for research institutions to start up a molecular diagnostic lab. However, and so that's all we do right now, but the however is that we are looking at the possibilities of expanding that testing. Our authorization right now allows for COVID-19 and some dual tests. So for instance, there's a dual test for influenza and COVID-19 that has been researched. It's not something that we have right now. It's something that, you know, we look into to see if it's a possibility for the future, particularly given where the pandemic goes. Equally, as Elena was mentioning, we now have a molecular diagnostic lab on campus. And the goal is to continue on that path after this pandemic and provide diagnostic testing in other areas, most likely as a first area, Elena's area of specialty, which is pediatric genomics. I'm conscious that we are getting to the end of our time, and so I wanted to follow up on Susan's comment around what people can do to help and where there are opportunities in the community. One of the things that we are doing when we follow up after this session is that we will be providing all the attendees with the bios of everybody who's been part of this panel. As part of that too, though, we're sending information about the various organizations that participate here. And from that, there are a lot of opportunities to work with those organizations, support those organizations, or get directed to other organizations that are in need. And certainly the Community Foundation will point towards a variety of sources for support as well. I'm wondering to close out, Cal, we had that question about opportunities for the future, positive opportunities that have been presented by this pandemic. Can you speak to what the county is seeing specifically?
I think the county has had a huge value in the community always, but it's been a little bit sort of behind the walls and not maybe a little bit opaque to the community. And I think right now the public health department is front and center. And I feel that it's good in many ways to have a larger presence and have more active interaction with the community partners. And I think it was always there, but I see this not going away. I think a lot of the bridges we've developed with our community partners will continue, and we'll build on those.
Terrific. Ryan, I see you're back online. Would you like to speak to that right as we're closing? And then.
Yeah, I mean, I think, as I said earlier, we really need so many of the challenges we face and are going to face are going to require collaborative partnerships between the public and the private and the nonprofit sectors. It's going to take us being a lot more agile and getting out of our lanes. And the more that we get through these experiences together and build those relationships, the more opportunity there is. And so I really see that as an opportunity going forward. And to echo Susan's point, I mean, it's while these institutions collaborating is a good thing, we also need community members helping and supporting each other one-on-one, checking on a neighbor, helping a parent who may be trying to hold down a job and have at-home learning, supporting your small businesses, supporting your nonprofits, your arts organizations. And people have just lost, more than 900 people have just lost their homes. So it's thinking, sort of starting every day with the presumption of how can I help my community will be essential for us to survive and thrive going forward.
Thank you so much for that. Absolutely, this community engagement issue is critical now and in the future. I would like to thank the panelists for being here, to the audience for being part of this. Please do continue to look at some of the UCSC Community Forum activities that we have. We are trying to emphasize the opportunity that's been presented honestly by online presentations to reach out and engage members of the community as often as possible. There's a UCSC events page. It will tell you more about what events are going on, including a forum on elections tonight, because we're obviously right at the cusp of critical change in our time. And also a CRAW lecture tomorrow night, which is very interesting with respect to the subject we've been talking about today, because part of the discussion will be around the potential use of sequencing for contact tracing in COVID-19. So thank you very much to everybody, and it's been a pleasure.
Thank you.
Thank you.
Good, thank you.